you'll see that this topic is going to be a really big topic over the next few years as more and more medications come to market. And the reason being is now there's going to be medications that can help slow the progression, not cure Alzheimer's yet, but slow the progression of the disease. And that's what's changed, is now there's going to be an opportunity for people to get access to those medications.
Let's learn how our next guest gets up, dress up, and show up on purpose. Enjoy the episode. Hello, morning enthusiasts. Welcome to the Best Morning Routine Ever podcast. I am your host, Dr. Lunid, and today I am thrilled. I'm elated. I have a phenomenal man here on the show today, Tom O'Neill. Tom is the president and CEO at CogniView. He has established himself as a leader in the field of cognitive assessment and testing within the healthcare systems. This is huge. His expertise extends to areas such as mild cognitive impairment, dementia, Alzheimer's disease, and it's really, really good to have this expertise on the show to talk about some of that stuff because, there's treatment, long-term treatment, trying to figure out how to handle and deal with a lot of these impairments. But now we have an expert on the show to actually help us understand more. So with no further ado, Tom, welcome to the show.
Thank you. Thank you, Dr. Lunita. Really appreciate to be here.
Yes, it's my pleasure. Now, tell me about the path to creating and starting
CogniView. What led to that? So I always love a hero story, right? Because everything we begin is it's personal.
Yeah, it is. I'll tell you what, I think if you talk to most people in the world, not many have lived their life without being touched by dementia or Alzheimer's. So the easiest way I'll explain it is there are 7 billion people approximately in this world. You won't find one that has survived Alzheimer's. You will find those that have survived cancer, those that have survived heart attacks, strokes, but not one that has survived Alzheimer's or dementia. I'm one of those people as well. And so, my family's been affected by it. And I think like any new technology or new company, there's a lot of challenges along the way. So right from the very start, right, I wasn't the founder. The founder was a brilliant neurologist and neuroscientist out of the University of Rochester. And he carried it through, he developed the technology, carried it through the FDA de novo process. De novo means there's never been anything like it. So did that, ran out of funding essentially, and ended up being acquired as a IP or intellectual property acquisition back in 2018. And then I came in, they brought me in to run it. It was me and literally 3 other people that were here starting the business back almost 6 years ago now.
Wow. Yeah. That you're absolutely right when you say that it's kind of grown and a lot to have been IPO'd, and now you're running it, you're keeping it lean as well. Right? There's only 6 of you running it.
Well, just to be clear, it was an IP acquisition, so intellectual property, not an IPO. So that was in 2018, where Tom Golisano, our primary investor, acquired the business and brought me in to commercialize this technology. So to bring it to market, we're now 6 years later, we're right around 37 people. We have 1,000 plus customers. We'll be roughly a $4 million business this year. And if you think about it, the challenge is the first 2 years was building a commercializable, viable, reliable technology device you can go commercialize. The next 2 years after we launched it was COVID. So if you think of the last 6 years, 4 of those years were either in product development or in the middle of COVID, and we still were able to grow the way we have.
Yeah, because it shows them too the great
need for this. And you're right, everybody has been impacted by it, especially here in the Western world, right? Because my own grandfather is now early onset Alzheimer's, and it's really
challenging. to deal with, but it is part
of our culture, right? And so I want to let's talk about how Cognitive View is helping these families, helping a lot of its clients during this process.
Yeah, so thank you for the question. So first off, we're a screening and assessment technology. So what we do is we provide clinicians, whether you're an audiologist, optometrist, a pharmacist, with a screening technology called Cognitive View Thrive, or we have an assessment, a 10-minute assessment that goes more towards the MDs, the doctors, like a neurologist, a neuropsych, a neuroscientist, a psychiatrist, psychologist, or a primary care, internal medicine, family practice doctor. So what we do is we provide them a technology that, quite honestly, is very different than everything that's been around in the past. So if you were to take a loved one, your mom or dad or grandma, grandpa, to have them looked at by their internal medicine or family practice doctor, they would have more than likely given them what's called a MOCA, or a mini mental status exam, a paper and pencil test, a question and answer test. And it's really difficult because it's administered by somebody, it's scored by somebody, it makes you feel stupid, it makes you feel denigrated. It's not a great feeling, it's not a great experience. Our technology, which is in those same practices, those clinical practices, is self-administered and self-scored, and it has no question and answers. It has, on the 5-minute Thrive screening, it has 6 exercises in 5 minutes, or in Cognitive View Clarity, the 10-minute assessment, it's 10 exercises in 10 minutes. So it's more, think of it more like gamification of cognitive assessment. We have 18 patents. We just filed a 19 patent on it. And you can see it over my right-hand shoulder, but think of it like a large laptop type device. But there's only one point of interaction and interface between the patient and the assessment, and that's the Cognowheel, because that's measuring the individual's motor skills, and then it adapts the rest of the subtest to that patient's motor ability, and then their visual acuity we test, and then it adapts to their visual acuity. So throughout the whole test, in 10 minutes, it's assessing that person's abilities and either making it more difficult the better they do, or slowing it down the less well they do. And ultimately, in the end, we get 130,000 data points from a 10-minute assessment, which then summarizes in a really clean, simple, easy to read report.
That's really impressive,
because then it's interactive. It's not just the paper and test where your questions are stationed, or just that you'll have those. And so the fact that it's actually moving along with the different levels, so it gives a more accurate reading for the doctors or the clinic to actually better assess the individual and where they're at, right? Because there's different stages of it. I'm realizing with my grandfather, because, at first it was just not remembering your name, and then it's getting lost when you go outside. So that progresses really quickly.
It does. And by the way, that's a great point. And our mission, our goal would be to really make cognitive assessment, brain health, literally like tested in your 30s, 40s, and 50s before it becomes something permanent like dementia or Alzheimer's. Because once it gets there, there's medications coming out for mild cognitive impairment and early Alzheimer's, but nothing for when it's a full-blown onset of Alzheimer's. If it's early, the first drug just got approved for that by the FDA in July of this year.
Yeah. Okay. And so
you said you have over 1,000 clients, and I imagine these are doctors and clinics. Do you know how many patients are being impacted?
So we put 82,000 patients through the Cognitive View assessment or screen across that customer base.
That is impressive. Yeah, that's
a lot of patients that you're actually getting to assess and accurately provide data. Now, let's talk about the before Cognitive View and after Cognitive.
Yep.
what are some of the results you're seeing? Because you have the data points.
Yeah, so a couple things is before CogniView was in existence, it was all these paper and pencil tests. And I would say that the majority of the time, and when let's say you would take your grandma or grandpa into their primary care doctor, most of the time, unless you brought it up or unless your grandma or grandpa brought it up, it would not be discussed. Brain health, memory, cognition would not be discussed. You would have to proactively talk about it. And doctors really, for the primary care doctors, really avoided the conversation. And they avoided it for three reasons. First off, because of patient flow. Primary care family practitioner docs have to see 30 to 40 patients a day. They get maybe 10 minutes with a patient. So very little time to be able to do a cognitive assessment, a true assessment. The second thing is, even if they do it, the payers, whether it's Blue Cross or Blue Shield, others may make it difficult for them to get reimbursed for the work they're doing on behalf of their patients. So that's a challenge. And then the third is that there's nothing they could write. There was no prescription they could write before. Now, there is something that you could do. You can empower your patients through diet, exercise, lifestyle, mindfulness, hearing, other types of things. You could have your patients make sure that they're eating right and exercising. That's really kind of changed, and it's changed as of late. And I'm talking like in the last 6 months. And you'll see that this topic is going to be a really big topic over the next few years as more and more medications come to market. And the reason being is now there's going to be medications that can help slow the progression, not cure Alzheimer's yet, but slow the progression of the disease. And that's what's changed, is now there's going to be an opportunity for people to get access to those medications. But let's say even if there isn't access to those medications, which there is, and CMS has come out and said they're going to pay for those medications. But even if there wasn't, I still would challenge that this Alzheimer's doesn't happen overnight. It's decades long influence of plaques and tangles build up, as you know. So the more you can coach and counsel your listeners, whether they're patients, whether they're caregivers, whether they're clinicians and doctors, is to get their patients screened early. And to me, listen, the best analogy I can make is I didn't start taking my Lipitor, my cholesterol medicine, until I saw my numbers, right? Until I saw what my cholesterol number is. Here, you take a CogniView and you get a report that says what my number is. It tells me where I fit within no impairment, mild impairment, or severe impairment. And that's an inflection point, just like it was for cholesterol. And now I'm going to be more focused on my diet and my exercise. Does that make sense? So before CogniView, I think it was all paper and pencil, and it was very difficult for all the reasons I just mentioned for doctors to do screenings and assessments. Now, I think because there's an intervention available, I think you'll see much more screening and assessment going on. And then I do think that beyond the medications, there's like the most modifiable risk factor to prevent dementia, Alzheimer's, is hearing loss. So if the intervention might not be a medication, it might be a hearing aid. So if you knew you could have a hearing aid, and that would delay any kind of onset, I would think that would cause a reaction for you to go and get a hearing assessment and maybe.
Yeah, you said something very interesting that provoked
a thought for me. Because you didn't mention genetic. You said, doctors are saying lifestyle changes, dieting, exercising. Even that, is that even enough, right? Where does genetic comes in and play a role in this? And because I know people who are healthy. It's just as they start aging, that starts happening. But I do agree, maybe a puzzle can help. I do agree the mind work can help, the creative thinking aspect of it. But there's definitely a bigger component. So let's talk about that. In some ways, one can get ahead of it, and then things that are just out of your control.
Yeah. So first off, I think it's a really great question and observation, because there are genetics that play a part. There's also the amyloid and plaque buildup that plays a part, but those by themselves don't necessarily mean you're gonna be diagnosed or you're gonna get dementia or Alzheimer's. So it's not that direct of a line. It's a very complex issue, because we know that even if you have the genetic disposition for it, if you have the gene, the ApoE gene for it, does not mean you're going to get Alzheimer's. Just like BRCA, just like breast cancer, right? You could have the gene but not get it. You could have the amyloid plaque in your brain and still not have Alzheimer's. So it's a multifaceted issue and disease state where you think about it in three ways: inflammation, circulation, and toxins. Inflammation, circulation, and toxins. And those, so from my perspective, and listen, I don't pretend to be a doctor. I just read a lot and listen a lot within this world that I live in cognitive function. And what I understand though is it really is about catching it as early as you can, any type of MCI, any type of mild cognitive impairment, and those modifiable risk factors, and those don't come from cognitive view. Those are the World Health Organization, the CDC Healthy Brains Initiative,
right.
The Lancet study. Those have an impact on those three things: inflammation, circulation, and toxins.
Yeah. And those I can see how the lifestyle
changes, the dieting, the exercising can help, especially with inflammation, and toxins like alcohol or even like environmental, right? We're talking about free radicals in the sun, like in the air, in the sun. And so just that knowledge, that awareness.
Yeah, think about everything we eat now and what's in the things that we eat. Think about the thing that's in the air, whether it's, pollution or whatever it might be. Those toxins have an impact. Alcohol has an impact, absolutely, on not only your brain health, but your overall well-being and health.
Yeah. Tell me about this plaque buildup, because
I don't think I have enough knowledge on it. Yeah. And so what does that look like? And how does it spread? What can you share?
Yeah. So the amyloid plaque, it can happen and build up over decades. And what they've identified through PET scans is many patients who have Alzheimer's end up having this plaque buildup in their brain. Okay. So the drug that just got approved, it's Eisai is the pharmaceutical company. Their drug Leqembi goes in and removes a significant portion of that plaque that hasn't solidified. So what it does is it's an infused base drug. So you have to go for an infusion twice a month to an infusion clinic and for 1 hour each time. And what it does is it removes a significant amount of that plaque so that it extends your ability to delay the process. Again, it doesn't cure, but it delays the process up to 5 or 6 months. So, and I think they're also doing studies to figure out if caught sooner. Remember, it takes decades to build up. If it's caught sooner, then it may be even more effective. This drug and Eli Lilly's next. They're expected to get approval, FDA approval in either December or January. So there's more coming. And by the way, Dr. Louis, there are 12 or 13 additional medications coming that are in phase 3 trials now over the next 4 years.
My grandfather doesn't have to take
all of them, right? We were just banking on one.
Just one. And I think you said he's been diagnosed with early onset. So I would suggest, not knowing, again, not a doctor, not diagnosing, but if he's been diagnosed with early onset, you should have the ability, and I don't know all of his other, challenges and health issues, but you should be able to take him to a neurologist or a geriatrician and possibly have access to that medication. Again, it's called Leqembi, and the FDA is, CMS is covering the cost, and they also now are covering the CT scan, or the PET scan that is required to get access to that medication.
Yeah. Okay. And as you mentioned earlier, just like, breast cancer, if you do have the genetic, you may not get it. And also with breast cancer, we have survivors that you remove the cancers, you remove all that, and then you can live and you without it. Sometimes it comes back. How is that not the same thing with the neurology or the brain when it comes to Alzheimer's?
Yeah. Unfortunately, we're still learning, right? So if you think about healthcare, healthcare has gotten so good that our bodies are outliving our brain, but the brain is still a relatively speaking unknown, right? So they've identified certain elements to the causes of Alzheimer's, but they haven't figured it out yet. They're working on everything, all kinds of different modes of action and ways to attack Alzheimer's, but there's a lot we don't know. And there's a lot that doctors are still, and brilliant scientists that I get to, interact with and talk to, that are working on those solutions. Because it isn't just clearly amyloid. It isn't just genetic. It isn't, and unfortunately, you can't remove the brain like you can parts of your breast that may alleviate that concern later on. So it is something that's going to take still years. I guess the way I think about it, because I think they're working on vaccines, they're working on cocktails, and what I mean by cocktails is, remember when HIV and AIDS came out and hit the market, it was not one drug fix, because it was a very complicated disease, right? So there's a cocktail of medications they put together that suppress that HIV, right? I think whether it's a vaccine or whether it's some type of drug cocktail, I think it's going to take more than one medication to fix the issues that have taken decades to exist within the brain.
Yeah, and that's why the research is needed. I actually have
A cousin of mine who is in NYU studying.
Okay.
Her thesis, a PhD, her thesis is on neurologist is on Alzheimer's, because there is such a great need. We are on the verge, right? A big breaking point of, like, we're not just dealing with it anymore. We are now looking to find ways to solve this and better treat it. And like you with Cognivue, with the device, it's like, as you said, you empower the patients by finding out earlier, doing it. If this plaque is going to take decades to build, it would behoove you to get on top of it and start getting tested earlier, and better testing too.
Absolutely. So the primary driver of most dementias is vascular. So if you think about vascular dementia, things that we talked about, diabetes, diet, alcohol consumption, smoking, all these things we do, if you knew that was going to directly correlate to something like Alzheimer's dementia later on, it may give you pause to say, listen, I have to change some of the things I'm doing in my lifestyle.
some of the habits. Yeah. Let's talk about habits.
How do you yourself get up and dress up and show up? What's your morning routine like?
Yeah, so thanks for asking. My morning routine has changed over the years. I am a morning person, so I actually have no problem waking up in the morning. It is kind of when I get my energy, but I start with I don't know if you ever heard of Athletic Greens, AG1. So I mix my AG1 with my Alpha Brain, and I take vitamin D's and K. And so I have that. I don't have coffee first. I have AG1 and then Alpha Brain and DK and vitamins D and K. And then I wait for about 45 minutes to an hour before I have my first coffee. I do work out in the morning. I like to work out in the morning. I get more, and it's something I've done my whole life. But for me, in the morning, it was more a function early on when my kids were little, and I traveled a lot. I was like, well, do I want to just come home from work and say, hey guys, good to see you, I'm going to leave for the gym now? I figured it was always better for me to work out in the morning while everybody was sleeping, so I wasn't taking time away from them. And then, when I came home from work, I was home, right? I wasn't coming home and then leaving. So my morning routine is really that. I have my vitamins and supplements. I have my workout. I get into work. I'm generally at work by 7 o'clock in the morning. And then I usually leave, 5:30, 6 o'clock, sometimes later, depending on what the job requires. And I'd love to say that it's a normal routine, but I travel a lot. I think for your entrepreneurs, for your founders, that every day creates a new challenge, and every day creates a new opportunity. So I think depending on how the days go, it depends whether I'm waking up in my bed or some other city, state, country, around the U.S. or around the world.
Yeah, it really is fascinating that you are moving with intention, right? Because you're saying, I have to be in the moment. I have to be present with the family in the afternoon. So in the morning is where I can actually get this done. And you've tackled you've done some hard stuff to kind of prepare you for the day, because it sets the tone. Energy, you get a lot of energy from working out. I'm a morning person. I find it a lot easier to do those things so I can show up for my family, show up for my team, show up for the company. And you're absolutely right. It's best to do it that way. Now, you mentioned some of, I think you said alpha, you're taking some brain stuff in the morning. As you are in this field, I'm curious. I'm going to probe a little more to tell us more about some of the benefits of taking those and what they are, so those who are listening, who are intrigued, can get some.
Yeah, so I got to tell you, listen. I'm not a scientist. You are. I am not, but I will tell you that for me, AG1 gives me all the basic vitamins and supplements that I need for the day. And then that Alpha Brain is just a brain supplement that I read about, heard about, and started taking, because I can mix it. It's a powder. I mix it with my AG1, and then the D and the K it's a dropper. So I use that as a defense, right, for any kinds of colds, flu, kind of other things that you can get. And so for me, I'm not always, I do intermittent fasting. So I only eat between 5 and 8 o'clock at night. I eat one meal and it's between 5 and 8 o'clock at night. So I know I need my vitamins, mineral supplements throughout the day. And that's what that does for me in the morning. And so I know there's a lot of different thoughts on this, and I'm not suggesting that mine is right, because I hear people talk about breakfast is the most important meal of the day. Not for me. I do my vitamins and supplements that way, and then I have a meal in the evening. So that's my routine. I can tell you this: it's helped me become more healthy, because my numbers, when I saw my doctor before I started doing the supplements and before I started doing the intermittent fasting, were nowhere near as where they are now. And now they're all within the range they should be.
Oh, that's phenomenal. And you brought
up something very important here, intermittent fasting, because we do get into ketosis when we fast, and that helps the brain tremendously in terms of creating creativity, focusing, and just expanding the mind. And so that plaque that we're talking about, that inflammation, it really, during this fasting state, your body starts eating away at the dead cells, the inflammation, the things that don't belong there. And so you are incorporating that. It's huge.
So I'm going to turn around and ask you a question. So you hear about the water fasting going on now, like 3 days or 5 days. They've talked about it, how it sheds the bad cells. Do you believe in that? Is that science that you understand or no? Because I have a couple of friends who have tried it, and I'm thinking of trying it.
Yeah. So when your body goes into ketosis, it starts burning its own fuel to stay alive. And so what it does attack first are those dead cells. It starts attacking those unhealthy things we have in the body, the buildup, and then it generates new ones. And so it's like having a new body. And they do say we get a new body, the whole cell replenish itself after 11 months or so. So it's actually, I do believe in that, and the science have actually been backing it up.
Yeah, I think that might be the next thing I try. I think that might be the next thing I try.
Yeah, no, what you're doing is actually getting you there as well. So that's why I brought it up. That's why it's huge. And I think a lot of people stay away from it thinking they got to starve themselves for an entire week. But no, it's just those hours, giving you 16 hours, 12 hours of fasting gets you there.
Well, think about it too. Just naturally, we grew up when we were cavemen and cavewomen. We ate when there was food. We didn't eat 3 square meals a day and then snacks at night after 8 o'clock. You were lucky if you ate once a day, right? So I think we've built ourselves into a society that is all about food and supply, and so I think a little bit of that is just self-control and managing yourself.
Yeah, and it's a holistic approach, right?
Especially for when we're adding cognitive view and adding the brain aspect to it. We're moving less too. We're more stationary. We're more at a desk, and we're not running. We're not chasing our food. We're not being chased as food.
It's true.
So,
well, they say that sedentaryism, just sitting around, is the new smoking, right? So, we're on our phones or we're on our computers and we're just sitting at and I'm guilty of that too. It's one of those things you really have to force yourself to move, and I do that with my parents. They're both 79. I think it's something that motion matters, and staying in motion matters.
Yeah, and it's
part of this whole like brain health aspect that we're talking about. We do need to keep it moving. Thank you for sharing. And the morning routine is not a cookie cutter. I like that you emphasize that it changes for you when you're traveling or when you're at home. When you have kids, like what stage your business is at, it varies 100%. It's not a cookie cutter, but the beauty is it works to fit you and whatever helps you show up better and be it. That's all that matters.
Yep, 100%.
Show up better, and that is a check mark towards a better you, a better health, a better brain. So 100%. Thank you for sharing that. I really like that statement. Tell us, Tom, where can we find you? How can we connect with you?
Yeah, absolutely. So I'll go to our website anytime, www.cognivue.com. And come anytime. And there's a lot of information on the website. You can print some of that information off, take it to your doctor if you want your doctor to have a free trial of our device at Cognivue. Or if you just want to learn more about what we do, if you're a physician or a clinician, absolutely, you can get a device yourself. So just come to the website. And then certainly for me personally, just find me on LinkedIn under Tom O'Neill, and happy to connect with you and love to share the journey.
Such an amazing conversation. Thank you for
sharing all that you know about Alzheimer's and how to treat it and what Cognivue is doing in this space. That's actually pivotal. It's really, really right on trying to catch it on early. I know you read 30 to an hour every morning. We love quotes. Give us with one of your favorite.
My favorite quote. So I'm not a big quote guy, but there's one quote that I tell and use all the time with my team. It's a Martin Luther King Jr. quote. If the ultimate measure of man is not where he stands in times of comfort and convenience, but where he stands in times of conflict and controversy. And I think it's really easy to be a leader and a great dad and a great parent and all the other stuff when stuff is going good. I think what true leadership and what Martin Luther King Jr. proved to us is true leadership is in times of conflict and controversy. So that's my quote. That's the one I live by.
And I love it. When your back's against the walls, you'll see the true man behind you. The true man will show up when your back's against the wall. That's well said. Thank you so much for sharing that. Tom, it's been such a pleasure having you on the show. Thank you again.
Thank you, Uni. Thank you. I really appreciate it.
Awesome.
Hope you enjoyed today's episode. Please comment and tell us what was your favorite part, your favorite habit that you are going to try out for yourself today. Comment below. If you haven't already, be sure to subscribe. Until next time, I will see you at the top of your best morning routine ever. Stay blessed.